The epilarynx is an ad hoc term for a part of the supraglottis which in most of the world is not regarded as a separate anatomical region except in France, because as per Gallic anatomists, the epilarynx consists of the suprahyoid epiglottis, the aryepiglottic fold medial aspect, and the epilarynx comprises of suprahyoid glottic, including the tip, anterior surface, laryngeal surface, the laryngeal aspect of the aryepiglottic fold, and the arytenoids. In France, the larynx is also described as being divisible into an epilarynx, also called the marginal zone, and the endolarynx. Therefore, in France, the larynx is divided into an epilarynx and endolarynx. This distinction is based on the similar natural history of tumors of the epilaryngeal region and those arising in the adjacent hypopharynx. The epilarynx comprises of the free border and posterior surface of the suprahyoid epiglottis, called the anterior epilarynx. In some classification, the anterior surface of the suprahyoid epiglottis is included. Number 2, the aryepiglottic fold, its medial aspect, which is called the lateral epilarynx. And number 3, the arytenoid and the interarytenoid incisurae, which is called the posterior epilarynx. So the parts of the epilarynx are anterior epilarynx, lateral epilarynx, and posterior epilarynx. Whereas the endolarynx comprises of infrahyoid supraglottis. The infrahyoid supraglottis comprises of infrahyoid epiglottis, false cords, and ventricles. The other parts of the endolarynx are glottis and subglottis. So the parts of the endolarynx comprises of infrahyoid supraglottis, glottis, and subglottis. Epilarynx patients appear to be much heavier drinkers than laryngeal patients, and their history is similar to pharyngeal patients, but tobacco consumption does not differ. The patterns of nodal involvement of epilarynx patients are similar to pharynx and epilaryngeal squamous cell carcinomas. For stages 1 and 2, patterns of failures were similar, but for stages 3 and 4, there are found to be fewer loco-regional failures in vestibule patients, and distant metastases were equally frequent for these tumors. From a standpoint of multiple primaries, epilaryngeal squamous cell carcinomas appear to be more similar to pharynx than to larynx, with a much lower incidence of lung cancers. This distinguishes it from endolaryngeal lesions. Finally, the outcome of treatment was different for vestibule, epilarynx, and pharynx squamous cell carcinomas, with a 5-year survival of 43, 27, and 13% in a study undertaken in France. These data therefore support the identification of epilarynx as a distinct real entity which should be taken into account for stratification in clinical trials.